The cutting edge of diagnosis, how liver biopsy saves lives. Liver biopsy is a critical diagnostic procedure used to assess liver health, diagnose liver diseases, and guide treatment decisions. This comprehensive article aims to provide a detailed understanding of liver biopsy, including its purpose, procedure, risks, interpretation of results, and its role in managing liver diseases. Purpose of liver biopsy. Liver biopsy is performed to obtain a small sample of liver tissue for microscopic examination. It helps identify the cause, severity, and stage of liver diseases, such as hepatitis, cirrhosis, non-alcoholic fatty liver disease, NAFLD, autoimmune liver diseases, and liver cancer. The biopsy results provide crucial information for accurate diagnosis and treatment planning. Liver biopsy procedure. Liver biopsy can be performed using different techniques, including percutaneous biopsy, transjugular biopsy, and laparoscopic biopsy. The most common approach is percutaneous biopsy, which involves inserting a thin needle through the skin and into the liver to obtain a tissue sample. The procedure is typically guided by ultrasound or other imaging techniques to ensure accuracy and safety. Preparations and considerations. Before a liver biopsy, certain preparations are necessary. These may include blood tests to assess blood clotting function, fasting prior to the procedure, and discontinuing certain medications that can increase bleeding risks. It is essential to inform the healthcare provider about any pre-existing medical conditions, allergies, or medications being taken. Risks and complications. While liver biopsy is generally considered safe, it carries some risks. The most common complications include pain or discomfort at the biopsy site, temporary bleeding, and, rarely, injury to nearby organs or structures. In some cases, serious complications such as bleeding requiring blood transfusion, infection, or damage to the bile ducts may occur. However, these complications are rare and the benefits of a liver biopsy often outweigh the risks. Interpretation of liver biopsy results. Liver biopsy samples are sent to a pathology laboratory, where they are analyzed under a microscope by a pathologist. The microscopic examination helps identify liver cell inflammation, fibrosis, scarring, presence of fatty deposits, presence of abnormal cells, and other specific features that aid in diagnosing liver diseases and determining their severity and progression. Alternative non-invasive diagnostic methods. In recent years, non-invasive methods have emerged as alternatives to liver biopsy for evaluating liver diseases. These include imaging techniques such as transient elastography, fibroscan, magnetic resonance elastography, MRE, and blood-based tests that measure liver enzymes, fibrosis markers, and genetic markers. While these non-invasive methods are valuable, liver biopsy remains the gold standard for definitive diagnosis and accurate staging. Role of liver biopsy in treatment decision-making. Liver biopsy plays a crucial role in guiding treatment decisions for liver diseases. It helps healthcare providers determine the most appropriate treatment approach, monitor disease progression or response to therapy, assess the need for liver transplantation, and identify potential complications or coexisting conditions that may influence treatment outcomes. Advances in liver biopsy techniques. Advancements in liver biopsy techniques have focused on improving safety, accuracy, and patient comfort. These include the use of ultrasound-guided biopsy, smaller needles, automated biopsy devices, and the development of real-time imaging techniques that allow for immediate evaluation of biopsy specimens. These advancements continue to refine the procedure and enhance patient care. Patient education and counseling. Before undergoing a liver biopsy, it is important for patients to be educated about the procedure, its risks, benefits, and potential outcomes. Healthcare providers should provide detailed information, address concerns, and ensure that patients have realistic expectations. Counseling and support are essential to alleviate anxiety and promote patient cooperation during the procedure. The future of liver disease diagnosis. As research and technology progress, the field of liver disease diagnosis is evolving. Continued efforts are being made to develop non-invasive diagnostic methods that provide accurate information comparable to liver biopsy. These advancements aim to minimize the need for invasive procedures while maintaining high diagnostic accuracy. Types of liver biopsy. In addition to percutaneous biopsy, transjugular liver biopsy and laparoscopic biopsy are alternative approaches. Transjugular liver biopsy is performed by inserting a catheter through the jugular vein and guiding it into the hepatic vein to obtain a liver tissue sample. This technique is useful in patients with coagulation disorders or ascites. Laparoscopic liver biopsy involves making small incisions in the abdomen and using a laparoscope to visualize and sample the liver. It is primarily used in cases where other biopsy methods are not feasible or when concurrent abdominal surgery is being performed. Benefits of liver biopsy. Liver biopsy provides several benefits in the diagnosis and management of liver diseases. It allows for accurate histological assessment of liver tissue, which helps differentiate between different liver conditions. Determine disease severity, assess the presence of inflammation, fibrosis, or cirrhosis, and guide appropriate treatment strategies. It also provides prognostic information and aids in monitoring disease progression or response to therapy. Potential limitations. While liver biopsy is a valuable diagnostic tool, it does have certain limitations. It is an invasive procedure that carries a small risk of complications, as mentioned earlier. Additionally, there is a possibility of sampling error, as liver diseases may exhibit focal or patchy involvement, and the sample obtained may not fully represent the entire liver. Close communication between the healthcare provider and pathologist is essential to ensure accurate interpretation of the biopsy results. Pre- and post-biopsy care. Prior to a liver biopsy, patients may undergo pre-procedure blood tests to assess clotting function and liver function. Medications that can affect blood clotting, such as anticoagulants or antiplatelet drugs, may need to be temporarily discontinued. After the procedure, patients are typically observed for a few hours to monitor for potential complications such as bleeding or pain. They may be advised to avoid heavy lifting, strenuous activities, or certain medications that can increase the risk of bleeding for a specified period following the biopsy. Patient experience and management of anxiety. Undergoing a liver biopsy can cause anxiety and apprehension in patients. Healthcare providers play a crucial role in providing information, addressing concerns, and ensuring patient comfort. Detailed explanations of the procedure, potential risks, benefits, and expected outcomes can help alleviate anxiety. Providing emotional support and allowing patients to ask questions and express their concerns are important aspects of patient care.